Grant, you ready?
That was sitting.
Yep, we just went live.
Who the heck was that person? That was Aaron.
Oh!
All right, good morning.
I wish I had right now.
Good morning, everyone. Dan?
Yeah.
Dan?
With
Good morning. I'd like to call the Door County Board of Supervisors to order on Friday, July 10th at approximately 9:10 a.m. Would you please join me in a pledge of allegiance to the flag?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. We're going to bypass roll call for the moment. We still have some...
Well, literally signed in.
Yes.
These people in the room.
But they're not. Okay.
If you need to sign in for your roll call roll in order to do roll call.
And how do we do that again?
With your app that looks like a capital.
Looks like the Capitol building.
And then there'll be a sign-in button on it.
Yeah.
Down on the
Just
bottom.
say sign in on the bottom.
Login?
Yep, that'd
I
be it.
didn't have to do anything.
I assume Laura can't connect.
Who?
Laura.
She's in.
Roy, you just popped out.
I did?
You can't.
I'm trying, okay, but then I can't get my agenda.
You have to put it side by side. Bob, you popped out.
Oh, sorry.
Okay. We never were taught how to do this side by side.
The screen is still blank, huh?
Your screen's blank?
It's supposed
Oh,
to be.
now it came up.
Should say present on the bottom.
Yep,
I'm going to mark Laura in.
yep. Oh, she just went in. Oh, you got it. Okay.
No, they have to check.
Yeah, you guys need to check in now on your app. Check in. Your roll call app. Make sure you mark present in your application.
So click on
Austin's not.
the present icon.
Quick on what?
I think the present icon says we're present.
Susie, you lost.
Susie
your
and,
connection.
oh, no, Nancy just need to have you connect. There you go. There you go.
I put you in.
Okay.
I put you in, but you're losing your.
Oh.
Am I back in?
You're back in. While you're present.
You
Stop the meeting until they can.
I'll take care of that one. Vinnie should be in now, you just have to
Yep.
promote her.
Okay.
She's in as a standard attendee here.
Okay, that's fine. I can't make our panels. That's what happened before.
And I touch our screen, though.
I can make anyone else, but when she does it, I can't.
There's got to be something that we're missing.
So what, room? Can't hear?
Vinnie's trying in yours.
Okay. So we currently have 19 present, we have one excused, and we have one that's still attempting to hook in. We will, it's Vinnie. When she's able to connect, we'll add her in. So we will continue. Presentation of the agenda.
I'll make them, I'll second it.
Okay.
You made the motion?
Susan?
Fisher.
Fisher. All in favor?
Aye.
Correspondence.
Okay, I just want to make a statement first before we go into correspondence, just for a couple of items as far as house cleaning. First one, just for individuals that are attending the meeting, and also just to give context. Again, the purpose of this meeting is more educational meeting, in that if you look at the agenda itself, we're looking at all the potential options that we have available to us. So our main purpose is to learn about those options, really by primary of looking at a potential ordinance, or whether whether the public health officer would issue an actual public health order. I guess just to make it clear to everyone in attendance here, and also those that are listening, is that at the end of this meeting, we will not have anything in place, simply because we cannot. Again, far as an ordinance, it has to be written beforehand, it has to be published, and it has to be adopted by the county board. So again, we cannot adopt an ordinance today. Likewise, you cannot force the public health officer to issue an order. That is, I guess, her authority. So again, just to give context to our meeting, it's really educational discussion. Let's all get on the same page. And with today's meeting, hopefully we can get maybe towards a consensus of where you want to direct staff, where to go, or provide Sue some feedback on where you think you're at in terms of supporting her or not supporting her. But again, I think I just want to set context so everyone feels comfortable, they can speak their opinion. And again, there's not going to be a decision at the end of this meeting in terms of moving forward. With that being said, again, the goal will be to cover those potential options and then also discuss the pros and cons of what those options are, so that way we all can build our level of knowledge and consensus of how we would like to move forward. In terms of moving into the public comment, the public comment will be limited to 3 minutes per comment, and we're going to limit it to 30 minutes, which would bring us until about 9:45. The way we usually conduct them is I will start first in the Peninsula Room, and then I will go to our online attendees. I guess I would ask the attendees, again, to refrain from, I guess, making duplicative comments. If you hear a comment and you'd like to just come up and say, I agree with the comment, or I support this, or I do not support that, we would appreciate it. Again, we're going to try to limit the comments to those 30 minutes. With that, I will first start off. Oops, sorry.
I have something I want to mention. I'm sure we've all gotten lots of emails, texts, and phone calls. Myself, I'm in the hundreds at the moment, and I just want to let everybody know, as we all do, we attempt to get back to everybody who sends us information, but when you have hundreds of calls, it's not possible to get back to everybody, so we just want to let everybody know who sent comments, text, emails, left voice messages, whatever, that we have received them. They are part of the record. They're part of our packet. We will continue to coordinate and collate them as we get them in. So I just wanted everybody out there in the public to understand that if you haven't been contacted back when you send us something, simply from the sheer volume, we've not been able to contact everybody back personally, but we have got your information and your comments on record.
Correct. And yep, thank you. And I'll just clarify that too, just a little further. So any email that was sent to myself or was sent to, I guess, what we would consider the full county board, which I was CC'd, we actually did make all copies of those, and those are part of the record, which were handed out. So again, for those individuals that are online, there's no need, I guess, to come back and reread your statement. We have provided it now as part of the formal record, and under the correspondence, it's been handed out to every county board member. So with that, I will go into the actual correspondence, and the way I'll start first is I did receive 2 calls from individuals that could not attend, and I said I would. Yes. I still can't make panels. And I said I just put it in as terms of the record. I received a call from an individual, Paul Anschutz, who is concerned about our parks, the county parks, in terms of wearing masks. And I also received a call from another individual who was not in support and says that the numbers do not support it. And if you actually do the math on the number of cases compared to our permanent population versus even our population right now with all the attendance, we're still under 0.1% of terms of positive cases. And I'm not advocating one way or another. Those are just the comments I said I'd put into the record. With that, I will go first now to the Peninsula Room. I will unmute the Peninsula Room. If you'd like to speak, I'd ask you to come up to the chair that I explained earlier. Give us your name and address, and then you can make a comment. And again, I'll limit the comments to 3 minutes. And the Peninsula Room, you are unmuted, and you are able to speak. Is there anyone in the Peninsula Room that would like to speak? Final call, is there anyone in the Peninsula Room who would like to speak? We're going to have someone just walk down just to double check, just to make sure if there's anyone trying to give comment. We're just for those who are online, we're just double checking to make sure that no one in the Peninsula Room who wants to speak is able to.
Peninsula Room in here?
A little bit.
No. Are they trying to speak?
Yeah, they're speaking.
Okay, so what we'll do is let's have them come in. Maybe Bob, could you move? And then we'll allow the public to come in from the Peninsula Room and speak at that mic. We'll just have them come in one at a time, Joe.
Yeah, I guess I can come back when the public.
Yep.
Oh, 1 second. I think part of it's going to be the sound, someone might touch the sound of the speaker. 1 second. Joe, can you hear us?
Test 1, 2, 3.
Okay, we got you again.
Would you like me to go back or to stay
While you're
here?
Thank you.
You can stay
Okay.
for this, yeah.
Okay.
Okay.
My name is Amy Russell, and I'm from Ephraim, and I just have 4 comments that I would like to make. And first of all, I guess where the precedence is coming from to consider this, I haven't seen a huge spike. We have had no more deaths, and seeing that a lot of this is based on Dane County, I just implore you that Door County is not Dane County. You know, that we can think about this. I also have a study here from the National Academy of Sciences that is requesting retraction from many studies published before showing that mask was the most effective intervention, when in fact they say it highlights the difficulty of doing science during a pandemic because it's more of an applied science. It hasn't been done through the rigors. They can't tell the difference if it's mask, social distancing, or hand washing. Scientists from Stanford and Johns Hopkins University also took the conclusion that many of these are based on false premises and just observation versus true science rigor. And I can leave this study with you as well. My other point is through Mayo Clinic. They've made a very interesting point about how people are wearing masks and what kinds of masks. For their point of view, wearing a mask like this, if I go to take it off and touch it, I have just contacted if in fact I have coronavirus and go and touch this surface. This kind is probably the least effective, and yet it's the most used. I would say anyone that has this does not repeatedly wear it over and over. It's to be thrown out. I see in here typical of what I see in the community. Some people have it on, some people don't. Some people it's under the nose, which defeats the purpose. Some people don't have all the straps attached. Some people had it off, put it on, pulled it back down again, similar to what we see in our community. And I guess the final thing for me that's important is that private business, I think, has a right to say you must wear a mask when you come in our store. Like no shirt, no shirt, no shirt, no shoes, no mask, no service. They have that right because they're private. But I also have a right to go in or to not go in based on their rules of their business. And I would just urge you to trust the people in Door County, trust the business people, trust us. I find I don't mask a lot, and I find that I'm very conscious of my 6-foot distance, where I find those that are masking have been less and less conscious, more willing to jump in front and stand there and act as if nothing. I feel like it's a false sense of security that we're giving the people when there's enough studies out there that are contradicting, and these kind of masks aren't really effective. As a matter of fact, they're supposed to be made out of 600 count cotton or cotton and polyester, very tight weave. Tight jersey or certain cottons are proving ineffective anyways. I can blow a candle out with this on my face. So I just urge you to just trust the people and trust the business people and let us be sensible. Something that's reasonable, we're willing to obey most of the time, but unreasonable makes it really hard sometimes for people to see the sense. So I thank you for listening and taking the time, and I appreciate this venue today. Thank you very much.
Thank you.
Thank you.
Thank you.
Would anybody like this study?
If you would leave it on the table there, I'll grab it, we'll make it part of the record.
Awesome. So let's just see. Can you hear us from the Peninsula Room?
Yes, Jason, we could have the next speaker come up if they'd like to speak. We cannot see you, but we can hear you.
My name is Jamie Haslam. I am a resident of Sturgeon Bay.
The people never consented to a single individual having that kind of power. That was said by Justice Rebecca Bradley. She went on during that session to reference the shutdown order as tyranny. A mask mandate would be tyranny. Coronavirus positive cases based on current counting methods in the state of Wisconsin are 0.65% of the population. Has anybody actually done the math? Yes, that's less than 1%. When have we, the people, allowed control over 99% of the population to protect 1%? We haven't ever shut down, recommended mask wearing, or mandated anything from many other viruses. When will government mandate healthy eating habits, getting rest, exercise, and getting enough time outdoors? That is what will keep our population healthy. There's two sides, and neither side is more right than the other. There are compelling reasons and many peer-reviewed medical studies that support both sides. Yes, I said both sides. That tells me the science, the real science, is never settled. Body autonomy is the right for a person to govern what happens to their body without external influence or coercion. You don't know a person's medical history to know what the best decision is for them. That decision must remain between an individual and their trusted healthcare provider. A government's job is not to control or limit a population, but instead it is to unite a population and preserve the rights of its people. A government is for the people, by the people. I encourage each of you to remember why you are seated where you are. It is because the people of this county at one point trusted you to preserve their rights. I emailed lists of peer-reviewed medical studies to each of you. Those studies outline the reasons why mask wearing is ineffective and even dangerous for many. There are studies that show wearing a mask actually weakens the wearer's immune system. Oxygen is a necessity for life. Everyone has the right to body autonomy. Many visitors will cancel trips here, won't patronize our hotels, campgrounds, restaurants, shops, etc. This will cause huge losses in revenue to small businesses that are already struggling. I've lived in Sturgeon Bay and I've been a lifelong resident of this county.
You have 30 seconds.
I walk in regularly with my family. If there's a mandate, I won't patronize local campgrounds. I won't do my grocery shopping locally. You will push local people towards online ordering and to shopping more outside of the county. You will push local people out and divide this county even further. My body, my choice. As a local government, I charge each of you with preserving the rights and uniting all of us. Stop the division, including division by race, income class, and masking. Thank you.
Thank you. Is there anyone else in the Peninsula room that would like to speak?
Come on.
Should we wash that off? Should we wash the microphone area off?
I'm William Berglund. I'm against this. I don't think it's the government's business to be infringing on our personal freedom. I made it to 82 years old. I've been through the Asian flu, the swine flu, measles, mumps, chickenpox, polio, real epidemics, and survived. And I believe in what they call our own immune system. It works pretty well. I know that what you're proposing is right out of the governor's playbook, which was turned down by the Wisconsin Supreme Court. Also, Racine County just did the same thing that you're proposing right now, and they were turned down by the courts. So should you enact this, I imagine you will be too. I'm reading all your client correspondence here. Many people are for this, but it is still an infringement of freedom, and people will rebel.
Thank you. Is there anyone else left in the Peninsula Rule that would like to make a comment?
Yes, good morning. My name is Beth Resch, and I'm a registered nurse at Door Kewaunee Medical Center, and I'm here today to speak on behalf of the hospital. As an infection preventionist and an emergency preparedness planner for the hospital, I have been working very closely with the leaders at the hospital, public health, and our community and regional partners. We have developed many new policies and procedures to keep patients, visitors, colleagues safe. All along, we have followed CDC guidelines, and we are supporting the mandatory masking in indoor public spaces and outdoor spaces where social distancing is not possible. Thank you.
Oh, we should hear that.
Thank you. Beth, could you repeat that last statement, just because it backed
Yes.
out?
Okay. I said we have developed many new policies and procedures to keep our patients, visitors, and colleagues safe. All along, we have followed CDC guidelines, and we are supporting mandatory masking in indoor public spaces and outdoor spaces where social distancing is not possible.
Thank you. We got that now.
Just
All right.
for everybody's reference, I did receive a copy
It's in the packet.
of the letter. It should be in the packet that you have.
Thank you. Is there anyone else then left in the Peninsula Rule who would like to speak? I'm not seeing anyone get up. So what I will do, we're going to go then now to the people that are on the WebEx. If you are on WebEx through your computer, there is a way to actually raise your hand. If you raise your hand, I will see that on my end, and then I will unmute your connection. There's also a way for call-in users then to also be recognized. You can hit a *3, and it actually raises your hand on the system itself. I will recognize you, and I'll unmute you. So for this process, I'll just start with the individuals as they come up into the queue in terms of being able to speak. And the first one is, I believe, and I apologize if I say the names wrong up front, I believe that the first one is Nancy Ackerley. You are unmuted and you have 3 minutes.
Thank you. I appreciate having a chance to talk. I believe that wearing masks is for our common good, just as our seat belts, bike helmets, speed limits, things like that. We have a chance in Door County to get ahead of the terrible rise in numbers that is expected to come. Right now, because I live in Sister Bay, it is impossible to walk through downtown doing social distancing at all, much less go any place else in Sister Bay. Our local businesses that are doing the right thing and demanding masks from people who come in have put up with an incredible amount of hassle and just abuse from people who resent having to wear masks. That being said, you would be able to provide a great deal of support for our local businesses, allowing them to stay open the entire season by requiring masks and being very clear about that to our visitors to Door County. It is not my body, my choice at all. When your choices impact my health and that of my family, then we need to mandate some kind of public support, public law, rule, whatever you want to call it. You can cherry pick any kind of research, but my gosh, you know, the fact that surgeons wear masks seems to imply that you can wear masks for a long period of time without harm, and that they're effective at preventing the spread of germs and viruses. There is no way to social distance in Sister Bay right now. There is no way to social distance in a lot of places, inside or outside. I urge you, please, to pass something requiring masking to support our local businesses and the health of our community. Thank you.
Thank you. Next one is Lynn Michaelson. You are unmuted. You have the floor. You have 3 minutes.
All right, can you hear me now? I see my microphone looks like it's still muted.
Nope, we can hear you.
Okay, perfect. And hi, Nancy Ackerley. I'd like to begin by thanking the gentleman in his 80s who's made it through everything, because I actually know a person age 57 who just passed away from coronavirus. She was a very dear friend of mine, so this really touches me hard. I currently live in Sturgeon Bay. I'm the mother of 4 children who work in the restaurant industry. 2 of them work in Door County, one at PC Junction and one at Bayside Tavern. My 2 oldest graduated from Gibraltar. They work at a restaurant in Milwaukee. The restaurant they work at takes very great precautions. A lot of the restaurants around them are closing doors because people are getting infected by the virus, so they have to shut down. I left my job at Greystone Castle a week ago today because it was the 4th of July weekend. I was really reluctant to do that because July and October are huge moneymakers. And, you know, I've been there forever, but I didn't feel safe. They don't wear masks there. I mean, they said, well, you can wear a mask, but it doesn't protect me. It only protects others. So there are increased cases in Wisconsin. The restaurants, or the states around us, have their restaurants closed except for outdoor seating and carry-out. Our restaurants are open. We have very little regulations. Some are set up, you know, quite well. Others aren't.
You have 30
I'm not
seconds.
sure exactly what to do. I mean, I think that one thing, you know, to consider is to share knowledge with the businesses. A lot of them are doing great things. I know that PC Junction is, you know, they're wearing masks. I printed off your whole entire agenda today. I'm looking at page 3 of what Dane County is doing under face coverings, and I know that the restaurant that my kids, Caitlin and Christian, are working at, well, they're not really kids, they're 23 and 25, but when people come in, they are required to wear face masks while they're ordering, and they need to keep them on unless they're eating.
Lynn, you're at 3 minutes. I need to move on to the next speaker. Thank you.
You can let me go, but you know, I had to leave my job to be a good example as a mom, and I really hope that, you know, knowing someone personally who's died from COVID, that, you know, really kind of take this seriously. And I know this is educational only, and you can't do anything today, and you're not making a decision or doing anything, but please do whatever you can.
Thank you,
I mean,
Lynn.
I left my job.
Lynn, thank you very much. I appreciate it. I need to move on and respect the time. Thank you. The next one is, I guess, Beth Williams. You are unmuted. You have the floor for 3 minutes.
Hi, thank you. I am a resident of Sister Bay. I have been here for 4 years. I am a business owner of Blue Heron Glass Hutching and Massage of Sister Bay. I am a massage therapist. It's very interesting when people come in from other states, let's say Illinois, and they say, we have a stay-at-home order and we can't do the things you can do here, but they're coming to our state along with many other people. I used to be a lifeguard. When I lifeguarded, I did not look to pick the people up from the bottom of the pool to resuscitate. I looked for times that were dangerous to stop an injury. I'm asking you to consider looking out for the welfare of businesses and citizens in this area of Door County to please keep us safe. I am for masks. I'm done.
Thank you. The next one in the queue is Derek. Derek, you have the floor. I just unmuted you.
Thanks for letting me speak. I'm from Sturgeon Bay. I just wanted to first say that I'm I'm for the whole masking thing, and I want to applaud everybody, like the board, and of all the stuff that you've done from the beginning. Kind of like hearing everybody's experiences and stuff. I myself lost 2 friends of mine ever since it started, one over in the United Kingdom, another one down in Florida. They were found after the fact, like a week later, so they don't know what caused their death. So all I want to say basically is I think with the pattern that you guys have been going as trying to be preventative to keep us safe, I feel, honestly, I think we should have the mask mandatory just because, honestly, yeah, our numbers may be down now with only, 54 or something like that. The problem is, I'd rather be a part of something to keep the numbers down, because sooner or later it's going to skyrocket, and honestly, the summer's going to be over, meaning you're going to have to shut all the businesses down. And personally, I think, do one thing to prevent the other thing. That's all I'm saying. I know one person said, well, we're not Dane County. Yeah, I know we're not Dane County, but we get a lot more people up here than Dane County sometimes. And that's the scary part of living up here, is the amount of people that do come up here. And I think the place I work, all the employees are mandatory, have to wear a mask when they're working. And I do have customers that come in. They're like, oh, are we supposed to wear a mask when we come in here? Unfortunately, I have to say, no, you're not required to have a mask. But I would personally feel a little bit more at ease if they did. That's just my 2 cents. So thank you for taking up this topic.
Thank you. Derek, can I just have your last name for the record, please?
Derek Demise.
Thank you. Angela Sherman, you're unmuted. You have the floor for 3 minutes.
Thank you. Angela Sherman, I'm from Fish Creek. I wrote you all a letter, an email, and I appreciate you having taken the time to read it. But I wanted to just say a couple of additional pieces to my letter. And one is, when we're asked to look at the numbers, we need to consider our community. Our community is not a community where our numbers alone can be viewed. But what happens is we have visitors who come here from all areas, and when they go home, if they have contracted COVID, current tracing may or may not get back to Door County and any interactions they may have had should they have recently visited our community. So we have to not only consider the current cases that we have here in Door County, but also the cases that may come here, and those people really unknowingly might bring it up here whether they're asymptomatic or pre-symptomatic, and they go home and we don't get that counted into our cases. So I think it's really important that we look at the bigger picture of this. Now, I am countlessly doing research as a school board member. I have to be on top of all of this information as you do. So I appreciate all the time and effort that I know that you are all putting into making this decision. And we need to think about the entire health of our community. The 10th Amendment says that that states have the right to act in public health crisis, which is what we have right now with the state of emergency declared both in our county, in our state, and federally. We are in that crisis, and we need to be acting ahead of the game. The one thing that I will leave you with is that the motto that I continue to have throughout this, since this all began, is if in the end we look back and we can say that we have overreacted, we have done our jobs well. We should never look back and say we could have done more, but that we did enough and we protected everyone to the best of our ability. So I really appreciate you all considering the data on this. There is so much of it And I really support a mask mandate. And thank you very much. May we all say in the end that we have overreacted.
Thank you. Kimberly Hazen, you are unmuted and you have the floor.
Hey, thank you so much. Can you hear me?
Yes.
Okay, so I'm not going to repeat what I've heard other folks say, but I am in favor of a mandate. I have several properties in Door County. I actually live permanently in Dane County, and we are implementing, as you know, the mask mandate starting Monday. I also write for a business magazine, so I'm sort of in touch with how businesses see this. We heard from the waitress that she quit her job on the 4th of July. I feel for these people. You don't really have a choice that you have to go to work and you have to put yourself at risk. If your customers are not wearing masks, if you're not able to socially distance, as we've heard, that's a dangerous situation for the employees of Door County. I really worry about that. I also just need to let you know, we have a lot of visitors from Illinois. They are already used to this mandate. They are already used to wearing masks. It's not a big deal. And the more you wear them, the more you realize it's no big deal. You take them off when you get home. You put them on when you go to the store. It just keeps everybody safe. Yes, it's like seatbelts and helmets. It's very hard to enforce. However, unlike seatbelts and helmets, this is not just protecting the one individual. This is protecting the entire community. So I would encourage you guys to sort of take this up, and I really appreciate you guys being our community leaders and thinking about this issue. I would just really encourage you, and I spoke to Joel last night, talked to Bob last night, I left a message for Dave. Please try not to keep try to keep an open mind and not come to this meeting with a decision already made, but listen to our community. We have very limited health care. We have an aging population. Door County needs a mask mandate. Thank you.
Thank you. Good. Okay, Mark Sherrod, you are unmuted and have the floor. Mark, are you there?
Mark Savard?
Yes, sorry.
Okay. All right, as a past county board member, I want to put myself in your place and ask you, each individual, do you believe that you have the power to tell somebody what to wear? Think of the power you are taking doing this. This is an unbelievable reach for a government official to tell somebody what to wear. Where does this end? And on that question, if you are going to require somebody to wear a mask, what will be the requirement to take off the rule? If you are going to make somebody wear a mask, then when are you going to say it's okay not to wear a mask? That has to be part of this. And who is going to enforce this? Don't we have enough things for our sheriff's deputies to do besides going around ticketing people who are keeping our businesses open, coming here to spend money? We were very fearful in Northern Door about the lockdown, and we just made it in time to open up so that we can run our businesses and actively participate in the economy. And now you guys are going to put it at risk again. Who is going to enforce this? Those are very powerful questions that you need to answer here. I cannot imagine the power you think you have to tell me and everybody in my family what to wear. That's outrageous. And I can guarantee you, you will be faced with lawsuits and you will lose. Don't go down this road. Thank you.
Thank you. Laura Gray, you are unmuted and you have the floor.
Hi, good morning. This is Laura Gray. People said the same thing about non-smoking when smoking became an issue, and that didn't kill any businesses. I'm in marketing, and personally, I feel safer going into businesses that are masking, and I've heard many, many, many people say the same thing. I think that if Door County was branding that we're safe, we're masking here, we're respecting your health, that people would be encouraged to come here rather than be afraid to come here because they know that there's massive crowds here. Frankly, you know, I think if somebody is afraid to or doesn't want to come here because they have to wear a mask, those people aren't taking precautions, and they're not somebody I want here in Door County. I think that the vast majority of people that want to come to Door County that may be afraid of large gatherings will be highly encouraged to come here if we were actually branding Door County as a safe place, a smart thing to do to come for entertainment. Thank you.
Thank you. We've actually went a little bit beyond the 30 minutes, so again, appreciate all the comments that we received from the public, but we're going to bring it back now to the county board, and I will turn it back over to our chairman.
Thank you. Supervisor's response to any of that, I'm sure we'll have a discussion. New business face coverings. I do want to mention a couple of things about the correspondence and the public comments that we have before we move to the new business items. Of the comments, correspondence, emails, texts that I received, did a small statistical analysis on it. 87% of the ones I received were for some type of mask ordinance or mandate. The other 13% were against it. When I broke it down, of all the responses that I received, about 50% of them were from businesses asking that we do something, the positive comments. About another 30% were actually from employees that were asking that we do something because they feel unsafe with the number of customers that come into the store. They're wearing a mask, but the customers are not. And the balance were visitors and residents, of course. So just my breakdown. The other thing I would mention is, of course, we did get the letter that you heard from Beth from Door County Medical Center. We also got letters of support from Door County Economic Development Corporation, from Destination Door County, the Long-Term Recovery Task Force, which is comprised of county, city, medical, and business-related entities, also by consensus is recommending that the county board pass some type of mask ordinance. All right, so with that, I will turn it over to Grant and Ken.
Yeah.
Well, good morning. Looks like I'm going first. So, can everybody hear me? Okay. First of all, I want to point out what I think is the obvious. My perspective is purely a legal perspective. While I appreciate, empathize, and sympathize with the public comment and personal views that were expressed today, they will not in any way, shape, or form inform my opinion on what is legally permissible and what is not. And I think that's the least you should expect from your county's corporation counsel. I would also be so bold as to say that our local health officer's position from a science, from a medical standpoint, is not going to be swayed or informed by public opinion. So what I'm going to deliver to you is simply the objective legal standards and criteria that we apply, and my best opinion as to what we can do and can't do without respect to anything else. So before we get into that, I think it's important that we set the context. Until earlier this year, we all felt, and by we, local units of government, were fairly safe in assuming that the state had the powers it exercised when it issued the Safer at Home order. The wheels kind of came off that train, and when the Wisconsin Supreme Court's decision came out in Wisconsin Legislature versus Palm, where we all know by now that the Safer at Home order was determined to be unconstitutional and was struck down. One of the important things to note from that decision, above and beyond the Supreme Court striking down the Safer at Home order, is the Supreme Court also gave the state a roadmap as to how it could accomplish what it wanted to accomplish consistent with the statutes. And I'm not going to go into it in detail, but in brief, it was through the administrative rulemaking process. For whatever reason, that process has not moved forward, so the responsibility for the response to COVID-19 has largely fell to the local units of government. And in large part, that means the cities and the counties. Certainly the villages and the towns have a role in this, but primarily because of their size and their resources, the responsibilities has fell to the city and the counties. So what we're talking about today is the local powers to address COVID-19 in the wake of the Wisconsin Legislature versus Palm decision. And what I should indicate is that decision came out on May 12th. And what we did in response to that is on May 14th, 2020, Door County Health Officer Sue Powers issued an order that remained in effect until May 19th, 2020, sort of to bridge the gap between the Supreme Court decision and when we could get suggestions and guidelines in place. On May 19th, Sue issued guidelines and recommendations that were titled Let's Safely Reopen Door County, and those have remained in full force and effect since the 19th, and her May 14th order has been off the books since May 19th. The other thing that the county did was on May 26th, the county board enacted an ordinance number 2020-6, which created Chapter 38 of the Door County Code, which recognized the county's emergency powers under 323.11 and 323.14 of the statutes, and the local health officer's powers under 252.03 of the statutes. And it establishes enforcement procedures and penalties for violation. We did that in response to the Supreme Court's decision because the Supreme Court was fairly clear in its skepticism about the ability to impose criminal penalties for violation of these types of orders or requirements. So at the present time, our enforcement authority would go through the county ordinance, which was purely civil, which are monetary penalties and injunctive relief. One thing that you've heard if you've been paying attention to the media is that the exercise of local authority to address COVID-19 does pose some litigation risk. And we've been watching, I mean the group of corporation councils and the Wisconsin Counties Association, two cases. One, which was mentioned earlier, is a case out of Racine. A CrossFit gym sued the city of Racine because it had enacted an ordinance that was similar to Safer at Home. In the last couple of weeks, the circuit court judge ruled that the city of Racine's ordinance was unconstitutional. That ruling has been appealed to the Wisconsin Court of Appeals, and it is pending in the Wisconsin Court of Appeals. What is of some significance is that the city of Racine sought temporary injunctive relief, asking the Wisconsin Court of Appeals to stay the circuit court judge's decision in validating their ordinance from going into effect. The Wisconsin Court of Appeals granted that temporary injunction, so while the lawsuit is pending, Racine's ordinance remains in full force and effect. I don't know what we can read into that, except the Wisconsin Court of Appeals was not convinced that the the city of Racine's ordinance would necessarily ultimately be determined to be unconstitutional. But I'm not party to that litigation, but that is the only litigation that's pending in state court relating to this matter. We have the distinct privilege of being a named defendant in the case that is pending in federal court right now. Door County and Health Officer Sue Powers are named defendants in a lawsuit that was filed by a group of Wisconsin residents in late May, early June in the U.S. District Court for the Eastern District of Wisconsin, federal court situated in Green Bay. The case is presently pending. It's in its very early stages, and I'm not going to talk aloud about the substance of it, except to say that, among other things, the lawsuit seeks to invalidate the local safer at home orders and ordinances and cease their enforcement, and alleges that these ordinances violate civil rights and also violate the Establishment Clause, the freedom of speech, and the right to assemble. So we're in the process of fighting that litigation now. Some very preliminary filings were due today. Those would be filed with the court, and we expect there to be some preliminary rulings near the end of July. I don't expect that they will fully resolve the case necessarily, or that we will have all the answers, but we're paying attention to those cases, the one in federal court and the one in state court, because they will inform our actions going forward, and will quite frankly define what a local public health officer and a local unit of government, whether it's a county, city, village, or towns, the sideboards of their authority in addressing issues like COVID-19 under the statutes as they currently exist. So we're waiting for those lawsuits, but while we're waiting for the outcome of those lawsuits, the COVID-19 pandemic continues, and we're trying to evaluate on an ongoing basis, not quite hourly, hour to hour, but certainly day to day, what we might be able to do and what we might not be able to do. Drafting, implementing, enforcing an order or an ordinance requiring masks is not straightforward or simple. And I want to emphasize that message. It's not like a light switch. You can't decide you're just going to do it in this present legal situation. There are gaps in the statutory framework and common law or case law as to the extent of a local health officer's and, in our case, county board's authority to deal with these sorts of situations. Whether a local health officer or a county has the authority to enact and enforce a masking requirement, and more importantly, to what extent, depends or will depend highly on the facts and circumstances. Now, what we have to remember is that the stakes are high. Certainly, the stakes are high because of the COVID-19. If we look nationally, doesn't appear on the face of things that it's under control, but on the other hand, the stakes are high from a litigation standpoint, because if the county or a local health officer takes a position that later on in litigation turns out to be incorrect, we will face potential liability for the other side's attorney's fees and perhaps for actual damages. We just don't know. So we want to be cautious and not rush into anything. I should also mention that the Wisconsin Counties Association has commissioned their general counsel, Von Briesen and Roper, with a task force made up of county officials and employees and staff members to issue some guidance by the end of July as to what they feel counties can do in these situations. So it gives you some perspective that they're taking more than a month to study this, just to issue some guidance documents, that this is an unsettled area of the law. Moving forward, if we were, and I'm not taking a position on whether we should or whether we shouldn't, I'm just going to indicate kind of the broad sideboards by which we can operate, is if we were inclined, by we, I should say, if the local health officer was inclined to enact an order, and Ken made a good point, that is entirely within her judgment and discretion. Statutorily, she acts based on the science, based on the law, and based on what she thinks is in the best interest and within the parameters of her authority under the statute to issue an order, or the county board were inclined to enact an ordinance. There's a few things you want to make sure that are well defined. First, Mark Savard kind of stole some of my thunder. You need an on-ramp and you need an off-ramp. I'm stealing some of Ken's thunder here, is it's easy to enact an ordinance or a requirement. It's much more difficult to untangle that once it's enacted. So you want to set up criteria, objective criteria as to why you're doing what you're doing. That would be the on-ramp. And then the off-ramp is objective criteria and standards as to how you get off the freeway, i.e. end the ordinance. You don't want to leave that up in the air. You don't want to leave that to be nebulous, because it becomes incredibly difficult, one, to get out from underneath it. Two, we want to give the people who are impacted by any such order or ordinance some direction as to what they need to do to get out from underneath whatever requirements that we may impose. And I want to take a little step back. We're talking about face masks today, but this would apply to any requirement or restriction that might be imposed related to COVID-19, whether it would be physical distancing, whether it is anything else that was in a safer at home order. You need to be careful as to what you do. Now, I'm not going to belabor the point, but the health officer's statutory powers exist under 252.03 Wisconsin statutes. And the relevant part of that statute to what we're talking about is the health officer has the authority to prevent, suppress, and control communicable diseases and forbid public gatherings when deemed necessary to control outbreaks or epidemics. So that is the statutory basis for her authority. The county board's authority is similar. It's set forth in 323.14 of the statutes and is actually grafted into our ordinance, both the county board's authority and the local health officers. So if we were inclined to do something, it's clear from the Palm decision that we would need to limit enforcement to the administrative enforcement remedies. That would be the civil penalties and the injunctive relief. Criminal penalties aren't going to fly currently. The restrictions would need to be well-defined, content neutral, and narrowly tailored to address the particular circumstances. So you couldn't enact, or I wouldn't recommend you enact an ordinance. I would not recommend that Sue issue a general order requiring all persons under all circumstances to wear a face mask. That wouldn't fly, and that's a little bit obvious and a ridiculous example. But you have to, again, identify the problem you're trying to fix, identify the solution, and have the solution be as narrow as possible to cure the problem, and in effect for the shortest time possible to cure the problem. So it's not, there's a lot of analysis and study that's going to go into anything we do by virtue of an order or an ordinance. You need to articulate the reasoning behind the restrictions or regulations to show that the restrictions are based on the facts, evidence, and science, and tied back to the statutory authority. And so, I guess to wrap up my part of this and to take questions, can we do something? I believe we can. It's not entirely, what's not entirely clear because of the Wisconsin Supreme Court's decision in the Wisconsin legislature versus Palm, what the extent of the local health officer's powers or the county board powers are. And I would just would advise you to proceed with caution and not rush into anything. And it may not, Sue is going to have to speak in terms of what she thinks is necessary, not necessary from science, medical perspective, how imminent it is or isn't. But from a legal perspective, if we have the time to kind of sit back and wait for the Wisconsin Counties Association to come up for guidance, to get a sense as to how these cases, the case we're involved in, which is pending in federal court, might be resolved, and the case in Racine that is pending in state court might be resolved, we obviously will be better situated. I understand sometimes we can't wait and we have to take action, and if we do, we will structure the order and structure the ordinance in a way that we think is defensible and exposes the county to the least possibility of litigation and liability.
Could you just cover the coverage of the difference for cities and towns?
Oh, yeah.
This is the difference between the order and the ordinance.
Our ordinance was actually the first ordinance that was enacted There have been subsequent ones. So there's a question, not under the local health officer's order. The local health officer's order applies across the county. There is a question as to whether or not our ordinance would be in effect in the incorporated areas of the county, because there's no statutory provision that says that it is. That could be remedied by the villages and the city, if they were inclined, to recognize the ordinance and indicate that it is in effect in the city or in the villages. That's something I would have to look into a little bit. The other issues I want to cover, and I forgot, have to do with the enforcement of the ordinance. And I'm not going to speak to who's going to write the citations. We have the authority, whether it's a local health officer, whether it's law enforcement, and those are decisions for other people. But in terms of prosecuting the case, that would fall to my office, because it's not criminal. It is purely a civil remedy involving monetary damages and civil injunctive relief. Cases would be referred to our office, and we would initiate the prosecution, not the district attorney's office. So, questions? I must have been clear as mud, thanks.
Sure, I guess what we'll do, Sue, why don't you, I know Sue wanted to make a statement, so I will unmute the Lakeshore. Sue, you're unmuted, and you have the floor.
Thank you. Good morning. Can you hear me okay?
Yes.
Yes.
Great. So I'm sure you're aware of the news. Across the nation, COVID's increasing. It's an alarming rate. Closer to home, Wisconsin has had a significant recent increase in cases. Yesterday, there was 754 new cases. I believe that's a record high. If it's not a record, it is close to the top. Wisconsin Department of Health Services website's new data section has regional and county updates. It's really informative. If you haven't visited it, go to the COVID activity level section. It's updated weekly. In the last 3 weeks, the color-coded state map they have on there has gotten progressively darker, indicating increasing cases. The majority of the state is now classified at high level. All of our neighboring counties are at high level. We remain at a moderate level. But in less than 3 weeks, we've had over a dozen. We've had 13 new positive cases in Door County. So we're at a total of 53 this morning. That's a big jump for us. Along with that, our follow-ups are getting much more extensive with an increasing amount of contact notifications. In other words, many more people are being exposed to the virus. We're getting also an increasing amount of notifications from other places, other health departments, about contacts here that we need to follow up with, because visitors from their counties returned home and were diagnosed with COVID. So these are people who were infectious during their visit to Door County. So then we follow up and notify their Door County close contacts and ask them to quarantine to keep our community safe. So people are no longer staying home. Whenever you leave home, you have an increased risk of being exposed to COVID. We know that the more people you interact with outside your household, the more chance of spread of infection, and that this virus is really very effectively spread. 20% of the new cases in Wisconsin in June had attended some type of large gathering, whether it be a private party, a bar, that type of thing, with people from outside of their household. And likewise, a large number of recent cases in Wisconsin were 20-somethings who attended a large gathering of that type. We've not seen that particular trend in Door County yet. The virus has been known to super spread at large gatherings. So what else have we learned about COVID? Symptoms range from mild to severe to death. We're still learning about the long-term health effects, lung scarring, heart damage, neurological, and of course, mental health effects. COVID is a serious disease. What are the tools we currently have to fight this disease? I'm tired of saying this, you're tired of hearing it. Physical distancing, face masks, hand washing. all the experts, CDC, Wisconsin Department of Health Services, World Health Organization, all the experts agree that those are the measures, the tools we can be using right now. I don't believe these should be disputed. There have been more and more studies and evidence which continue to indicate the effectiveness of fabric face masks for COVID prevention when worn by the general public. In the meeting packet, there's the CDC information, so I'm not going to go into any more on this except to say, again, mask effectiveness should not be in question here this morning. They are an effective way, when worn correctly, of course, to prevent spread of COVID. This has been proven. Just one interesting case study as an example. In late May, 2 hairstylists in Missouri had close contact with 140 clients. While each of them were sick with COVID-19, everyone wore a mask and none of the clients tested positive. Indoor settings, close quarters with less ventilation, we know are the most risky. Outdoor settings are better, but there's no research to say that COVID is not spread outside. In other words, I'm saying outdoor settings are not risk-free. Other considerations, and these have been mentioned, our county is unique with over 30% of people over 65 and therefore more vulnerable. And of course, we have the influx of up to a couple million visitors here annually, and we're in the midst of that season now. Personally, I'm really disappointed by the low number of people I see wearing masks in our community. Yesterday, I attended a meeting of the Northeast Wisconsin Health Officers. Of course, that was a virtual meeting, and everyone expressed the same concern about their communities, that they are not seeing people wearing masks. At present, none of their jurisdictions are considering face mask ordinances, nor are the health officers considering at this point issuing health orders. Close to home, Door County Public Health, we're busier than we've ever been. We're focused on stopping the spread of COVID in our community. Somebody posed the question earlier, where does this end? That was in a little different context, but yes, where does this COVID end? We're planning our measures for at least 6 months out because it really looks like it's going to be around at least that long. Every day we have a team meeting and we need to focus on positives and most importantly, working together to support each other. It's really tempting to get overwhelmed, but we remind each other that all we can do is the best we can do. So I see a lot of positives here this morning. I'm really encouraged and happy that much of our community is clearly concerned and engaged to help prevent the spread of COVID, judging by all the emails we've received. Face masks have scientific evidence as effective, important prevention measure. Again, I don't believe we should be debating their use or importance. We all need to be taking that simple, effective measure when we're out in public by wearing face masks. I was really not looking forward to this meeting too much. I feel like we're anticipating some sort of fight. I've gotten communication from people on both sides of the fence regarding this, and everyone's really excited, whichever side they're on. Starting with what we can agree on, I hope we can all agree that we want our community to remain as safe as possible and not lose any more ground in the fight against the virus. We'd like our businesses to remain open, our children to be able to attend school in the fall safely. None of us could have ever imagined the situation we're in today, and there's not a clear path. Well, of course, face masks are important. I am not at all sure at this point how to get people to wear them on a consistent basis. Our climate in the country and right here is such that people are challenging experts, challenging us at public health on a daily basis when we do follow-ups. Most people want to cooperate with us, but there are an increasing number who voice either not wanting to quarantine, not believing us, enforcing none of our business. This pandemic really makes it clear how intertwined our individual health is with one another, and this is clearly uncomfortable for us. We don't like to think that way. Would an ordinance or a health order help? I'm not sure. Would this cause further divide or fighting between us? How would we enforce it? In true COVID fashion, there are more questions than answers. We could get really overwhelmed here with COVID. Let's not let that happen. I hope this morning in this conversation we can try to work together, support each other, do the best we can do, and try to focus on solutions in the true fight, which is against COVID. Those are all my comments for now.
Thank you, Sue. Before we'll take questions, I know, Pat, you're there on behalf of the sheriff. Maybe you would like to also, I know the sheriff wanted to also make a statement as well. So, Pat, did you want to cover anything or make a statement?
I guess the biggest concern that the sheriff's office has is from the enforcement standpoint. It's our busiest season of the year, and we're triaging calls right now. And logistically, it would be very difficult for us to proactively go to locations where there's large gatherings and enforce masks, or even respond to calls where people are violating this ordinance. So, like I said, ours is from a more of a practical standpoint from the enforcement side of things, and we would find it very difficult.
Tammy's out there. Thank you.
Did anybody have questions of Sue or?
Go ahead. I do have one from Alexis.
Oh, go ahead.
So, Sue, I just have a question from Alexis. She asked, is there a case of a healthy individual appropriately wearing a mask that was negatively impacted by carbon dioxide poisoning, passing out, etc.? And that was a question asked by Alexis.
Sure. So yes, that question has been asked, and there is no scientific basis for that. And practically, I mean, we all know that air moves around the sides of our mask. The mask is to prevent our spit to come out at someone. It's not to completely enclose our face. There is no truth to the idea, and there's been no cases of harm in that way, at least that I'm aware of.
Okay. Ken, you're not on the board, but I'll go to you first.
Oh, thank you, Mr. Chairman. Yeah, to Sue, we have 53 cases of COVID active cases in the county right now?
No, that's the total. We have, I believe it's 8 active cases because some have recovered and we've had 3 deaths.
8 active cases?
Correct.
Okay, and I just got a text message for somebody. So I'm only the messenger here, the questioner. They wanted to know what the mortality rate is according to the CDC and WHO as to, as World Health Organization, I do know what it means, what the mortality rate is overall for COVID-19. Do you have that number?
That is a good question. I do not have that number off the top of my head. I'd have to research that. I could get back to you if you'd like.
Yeah, I'd appreciate it just to get that out. Thank you.
Susan?
Sue, I'm wondering if, when you do your contact tracing, 2 questions. One is, the people who you're hearing from, the public health nurses of other counties, do you have, or do they have a sense whether the person came to Door County with the virus and then returned home when they got symptoms, or whether they actually contracted it here? And then my second question is, do you have a sense of what, if they've contracted it here, what types of businesses or what are their experiences where they may have contracted it?
So I cannot answer your first question, Susan. I do know that some people were here and had no symptoms and then went home and developed them. But as for, we've just had in the last week, a handful of those situations, so there's no true trend. And, you know, as far as where they contracted it, unknown. There's community transmission widespread. There are no particular trends, or we would be investigating that. Say if there was a particular business or situation, we would certainly be investigating that.
Thank you.
You bet.
Vinny?
Thank you. Can you hear me?
Yes.
Thank you. Sue, I'm wondering if you have, and I know it's, as these cases are increasing from, that you're finding out from other counties, if you have some sense of the number of counties and like at what threshold do they report back to Door County? Is it if the person voluntarily says they've traveled to the county, then you would be contacted? And about how many of those contacts are you getting? Thank you.
So to answer the last part, Vinny, roughly a handful in the last week, and honestly, I could look up on our electronic reporting system exact numbers. I don't have that in front of me, nor am I the one that's doing all those follow-ups. So if Rachel were here, she could give us a better idea. And now I've forgotten the first part of your question. I'm sorry.
I just didn't know if at what level that you are contacted.
Sure.
By outside of the state of Wisconsin as well, or are you just getting contacts from counties people travel from within the state of Wisconsin? What are other states doing? Thank you.
Everyone is doing contact tracing in the same fashion. So if, say, you know, someone is diagnosed with COVID today, we call them and we talk to them about when their symptoms began. You are contagious 2 days before your symptoms begin. So we go back that far and we begin asking them questions in a very thorough manner about where they were, what they did, who they saw, who they interacted with. We determine close contacts by specific criteria of were you within 6 feet for 15 minutes or longer, and that is not necessarily consecutive. So if you work with someone and you talk with them closely for 5 minutes 3 times throughout the day, that would qualify as a close contact. Or if you have direct contact, hugging or something, or sharing a drink or food, something in that fashion. So we do that investigation, and then if we find out that they were in Milwaukee, we contact the Milwaukee Health Department if there's a close contact there, right? I was in Milwaukee, I attended a party, and I was in close contact with those 5 people at the party, and this is when it occurred, and these are their names. So, and we contact the health department that they live in for follow-up. Sometimes we follow up with folks from other places because we just have a phone number. So I hope that answers kind of the process. Is that what you're getting at?
It was, and I also was just wondering how it goes in reverse. Like, would the state, someone who lives in the state of North Carolina or, you know, Florida or anywhere else that's traveled here, would they contact you as well from another state? Thank you.
Yes, they would, in theory. Now, I think some places are more overwhelmed than others. The exact process is that it goes, say, from the state of Florida to the state of Wisconsin, and the state of Wisconsin folks send it via the electronic system into our jurisdiction, and then we follow up.
Thank you.
You bet.
Megan?
Thank you very much. Sue, can you verify, please, that our numbers are strictly folks that are local or listing this as their primary address? Is that accurate?
Megan, they are residents. Mm-hmm. They are listing a Door County address. They may be a seasonal resident. Mm-hmm. So it might not, you know, I don't know what you mean by permanent, but they are here with a Door County address. If somebody is here for a week or two, no, they're not in our case count.
Okay, so our visitors, if you will, the tourists to this area are not included in that case count whatsoever.
Correct,
Even if they are-
because
even
that
if they are
goes by
tested here.
their address, their county of residence.
Okay, thank you. I appreciate that. Also, would you be able to clarify, there's a lot of folks in Door County that work in the service industry, whether that is full-time or part-time, especially this time of year, myself included. Any customer that comes into a place of business, that server is having multiple contacts with that customer, would that be qualifying, handling their dishes that their saliva has been on, serving them drinks, taking their glassware, such things, would that qualify as close contact?
Megan, it's really more person to person. So while there is some risk of spread on those items you described, that would not qualify as a close contact. And in that situation, I would hope that after you handle those things, you're washing your hands or using hand sanitizer.
So approaching a table and having a short conversation or having a conversation across the bar from a customer would not qualify as close contact?
If it was very brief, no, it would not.
Okay. Thank you.
You're welcome.
Erin, did you have a question?
I feel like she answered it, so.
Okay.
Hello. Did you? Jill, are you managing the? No. No, we're just trying to figure out their doctor. Is there anyone else who wanted to speak? We're watching the queue. I don't know. No.
David?
I knew how to turn this on.
There it is. Done. Is it on?
No. I could approach the other microphone.
Okay.
Sue, you alluded to the schools opening this fall. I guess if some sort of ordinance was enacted, how would that affect the schools as they open and their ability to even open?
I can tell you that we've been working with the schools, and they are all having the goal of reopening at the physical school buildings. They are also planning to encourage students and staff to wear masks. So I think it might support them in that effort, help convince reluctant parents perhaps. There's a question about younger kids being able to wear them, and of course, we can only do the best we can. I know, Madison's order was age 5 and under, we're not part of it. So I do believe an ordinance would support the schools.
Bob?
Thank you. I would like to thank you again, Sue, for all your work and your diligence. I can't even imagine the amount of stress and sleeplessness you have. My kid's really into the Avengers, and you're my superhero. I think as we move forward, however this goes, a piece of information that we're going to need, and I don't know how readily available this is, and maybe it's sort of evolving, but I think we need to know, we hear stories about, oh, such and such a restaurant, there was a ton of people in there, and the servers didn't have masks on, and the customers didn't have masks on, they're a hot spot. Oh, such and such a business had this event, and whatever, or there was a wedding here, or, I think it's easy to maybe think about, or it's easy to wonder where the spread is happening. I think we need to have more information about, now we're hearing like, okay, it sounds like this notion that 20-somethings in Madison seem to be spiking because the bars were open. I think that's the kind of specifics that we're going to need to go forward, so really knowing like where those hotspots are, because I think if we are to, especially if we're getting into the realm of an ordinance, it's going to have to be really tight and really specific, and that kind of information will help guide that. Thank you very much.
Susan?
Hi, Sue, I don't know whether you're the person to ask this, but I'm hoping if you aren't, maybe we can find this out from somebody else. You are part of the task force, the reopening task force, and that worked with the hospital and EDC and Destination Door County and the county and all of that to do the campaign that included the logos and the letterhead and all of the marketing to encourage businesses to sign on to that campaign of setting up a safe environment for their employees and for their customers. And I'm wondering if we can find out which businesses and how many signed on to that. To what extent that has worked or not worked. Are people making, and I don't know that you can necessarily answer this, but I'm hoping somebody can, because I agree with Bob. We kind of need some specifics to have a sense of the right way to go.
Yeah, very good question. When we rolled that out, it was well received and embraced by a lot of businesses, and I know that's not very specific. Perhaps John Jarosh from Destination Door County or Steve Jenkins from the DC Door County Economic Development Corporation would have a better sense of that or could get us that information.
Thank you.
Any other questions for Sue?
Guys, add one?
Yes, please.
I just want to add one thing, and again, I think most of the things have been stated, so I will not, I guess, reiterate or take up more extra time, but just to knock home some of the points that Grant had made and some of the things that I just worry about in terms of what we do. One is, again, I think it was mentioned by multiple supervisors and also by Grant about making sure we target what we're thinking about. Again, I know a lot of what we're talking about is related to maybe the tourism industry, but also remember we have some very significant large employers that are involved in manufacturing. And again, when we look at those types of orders or we consider those types of things, are they included, not included? What does that mean in terms of that? So I've heard some comments in regards to that. So I just want to make sure we're cognizant of when we look at something, we need to think this beyond. I mean, Door County is, we're well diversified in many ways, and I think you need to make sure if we do something, this can't be general, because again, if we make it general, we impact a lot of areas that we're not aware of. So that's just one thing I wanted to bring up. The one thing I will just stress too is kind of what Grant had mentioned, and this is based off both what we've seen both at the state, but I can tell you that we are personally experiencing it. Although it's stressful, probably one of the easiest things that we did was close when the governor's order came down. But I can tell you right now that we are struggling significantly trying to get things back open. And again, it's part of it is COVID, but part of it is to me this is, and there's going to be a lot of studies in the future, and this does have a mental health impact on many individuals. And it's not, I'm not saying it's good, bad, or indifferent. It's just different people take this different, and we're experiencing that. So whatever we do in terms of moving forward, I agree strongly that we need to have a plan, vision, that's very clear and concise of how we, I guess, return to whatever we consider normal in the future. We are struggling with that significantly within our own workforce and just trying to get people feel comfortable coming back to work. So that's just one thing just to throw onto this mix in terms of what we're trying to do. I know Grant mentioned this being smart just from a legal standpoint. Again, I don't think we should be fearful as a government, but I also think we need to be smart. Because when they do look at damages, that's just one of the things from my protective side as your administrator I need to think about. And then this is the last one, just from my standpoint, I know one of the things I've gotten just as many calls, I'm sure as many as you have in this past week. The one thing I do though is come back to enforcement. Again, when a government acts and they put something out on a table, I've heard a lot of comments saying, well, we just need to do it because the businesses need it. And there's a certain portion of the population that's going to live with that and say, well, at least now I can use that wording. But I can tell you there's also a large part of that population that expects us to truly enforce this. And again, I'm not disclosing how many deputies we have out at one point in time, but I can tell you we're very limited in terms of what we have out on the road. And I mean, just take this past weekend as an example. I could have probably had all of our deputies just walking around one of the beaches or just one of the areas in Door County, just based off what people would interpret whether or not they think I'm wearing my mask right or not, right? So Ken's walking down, he has his mask not covering his nose. I'm going to call 911. So again, I'm not trying to dampen it, and I think if we need to do that, but I do think you can't, I don't think we should put, I'll just be honest, I don't think we should put Tammy out there as our elected official, and Tammy's being honest saying I can't enforce it. So now the public's going to get mad and do a recall on Tammy because we passed an ordinance that we're expecting her to enforce. We can't, I think that's where it comes to be important that we don't divide one another. And if we approach something, we need to be united in how we do it, and we can't set up our own sheriff's department to be the negative ones in this. So I just want to throw out that caution that whatever we do, we just got to make sure we're balanced and thoughtful. So we got to take our time and make sure we can build some consensus on this. So that was my spiel. There's other stuff, but I think it's been said, so I'll stop right there.
Okay. Vinny?
Thank you. Two questions that I have are about, I've heard of other communities and school boards and other places, I'm not saying here in Door County, that are looking at thresholds of how they make their decision to close a school or continue in physical way to have school or to go to online school only. I'm just wondering if we are going to establish some kind of a threshold where we would at least be, we have the numbers, but it's kind of difficult to understand the severity of the numbers in relation to the number of people who live here and then also who visit here, and then not knowing the numbers of the people who have visited and left. It's difficult to make a decision. So that taking the time to come up with what is the threshold where we feel we need more action to be taken would be very helpful. And I agree that I wouldn't want to put someone in the ability to not enforce something that people will assume would be enforced. And my last comment is that I think as a community, and not to sound judgmental, but I think we could do a better job in marketing to our visitors the techniques we want them to use to be safe. This information is very hard to find unless you go on the county website. It isn't prominently displayed on the places where visitors go to find out information about Door County. So I think some of that could help strengthen what our recommendations instead of feeling that they necessarily have to be required before that's been done. Thank you.
Thank you. Aaron?
Yeah, thank you. I appreciate that comment, Vinny, too, and like having positive education and even the idea of a billboard of all the drivers that come up here without looking online for any information, too. But I also just wanted to support what Ken was saying in terms of, you know, if we're employing our sheriffs to be the enforcers, that's like an automatic, you know, escalation of system, you know, an interaction. And, you know, I think that being very specific going forward is very key for us. So I just appreciate all the conversations and comments today. So thank you.
Thank you. Elizabeth?
I also agree with the two supervisors who just spoke and Ken as well. And I guess I have some confusion. We have businesses or people complaining of or worried that they're not able to be safe. And then we have the issue of enforcement. I would think the first line of enforcement would be the businesses. A business can say to a customer that you are not, and please correct me if I'm saying this wrong, but any business can ask a customer to be removed if they refuse to follow the order of the business, which in this case could be a face covering, and they could refuse them service. I would think that line of enforcement, and every business could have that be for every customer coming in, every employee, and that's a choice of that individual business based on their particular risk. why are we, I guess I'm confused as to why some businesses may be wanting us to issue an order when that could be done more efficiently and enforced readily through them. Thank you.
Megan?
Thank you. I can actually speak to that personally. In our restaurants and bars, our income is 100%, well, not 100%, but very much dependent on how those individuals are deeming our service. So this was a point I was going to make later in this comment. But what's happening with a lot of our visitors to Door County is they are coming from areas where masking is required, and they're getting up here and they're just making this their playground, and it is extremely evident. So I work at a restaurant where masks are required by all of the staff, and we also have signage absolutely everywhere. We have sanitation, we have very good practices. However, when we are repetitively met with customers who are walking up to our hostess, a 16-year-old girl, and doing so unmasked. So we're putting employees such as that, or those of us that are dependent on their tips, to really be the enforcers in those moments, and that can be a really uncomfortable position to be in. So that is the other side of that, whereas if they were able to say, this is what I'm hearing from them and from my coworkers over at Cedar Crossing, is that if they were able to say, oh, well, it is a county mandate that you do have to wear your mask indoors on your way to the bathroom, or when you're not seated at your table, or when you're not seated at the bar, that would be really helpful to them. So that's what I'm hearing from them, because their income really is dependent on those relationships that they're building with that clientele. The other part of that point, when I say that they're making Door County their playground, it is extreme what I've ran into, and this is a nice place that I work in, right? It's extreme what I've ran into already from customers and the comments that they will make. They will pick on employees for wearing their masks. They'll say, oh, you can take that off. You don't need to wear that around me. Stuff like that. I mean, there's a dialogue that happens, or they'll complain that they are unable to hear their server. Things of that nature. So that is other things that are coming into play with that. I am also hearing from other customers that they are choosing restaurants such as mine because of the precautions that we are taking, and that they feel very unsafe actually when they will drive past other establishments in Sturgeon Bay and further up north, where there are very large gatherings of people. In fact, I had a few customers this past weekend who said that they drove up north and turned straight around and came back down. That they did not feel safe being up there. They actually, one couple canceled their reservations up north because it wasn't what they expected. So a lot of folks, what I'm hearing, and these in particular were from the Chicago area, are coming here because our numbers are low. They feel safer because our numbers are low. And that's why they're coming here. And I had folks in from Iowa last night that were pro-mask, and that's why they were coming here, is because our numbers were low. So there's both sides of that. So also a couple other things I wanted to mention. Some folks in public comment mentioned that we should have some sort of focus on wellness initiatives and how to stay healthy, and I think that is a great point. That is something that public health does do normally. They are a bit strapped at this time with dealing with COVID. So yes, that is heard. I agree with that. There should be wellness initiatives put in place as well. That doesn't necessarily have to be coming from a county body. with all of the constituents that I've heard from, when we're talking about a black and white mask mandate versus non-mask mandate, about 70% of my constituency was for a mask mandate. There is a very real economic impact to consider here. If we want to take speculation out of it, though, that would be helpful. Because if we end up having to be reactive and having to shut down again, then actually many of our small businesses will indeed fail. That is what I'm hearing from folks around the county, that they will not be able to weather another shutdown. So that is speculation, and that is if we would have to end up acting reactively. So I'm hopeful that we would be able to be proactive instead. I believe that we have the responsibility put on us to do so in order to protect our public. I think that we should be trusting our local health professionals, both those at Door Kewaunee Medical Center and our folks at the health department. Enforceability most certainly is a question and something that I believe our sheriff's department cannot take on. But what I'm hearing from constituents is whether it's enforceable or not, please just give us something that we can use in our businesses to help support our staff when dealing with visitors. So in closing, I support that the Door County Board of Supervisors act, whether it's under emergency order or whatever that looks like, to make masks required in all places where 6-foot distancing cannot be reasonably maintained. This would include bars, restaurants, lodging common areas, stores, grocery stores, and retail spaces. I think that offices, private providers, clubs, and gyms, as well as manufacturers could be exempt from this order based on their distancing practices, and hopefully would set their own guidelines with the health and well-being of all of their employees in mind. Thank you.
Thank you, Megan. Kara?
Thank you, Chairperson. I agree with the board member that just spoke about being able to go back to customers and say that it's a county mandate and being able to have that enforcement at a business level. It seems like people might listen more. So I agree with her that the first line is the business, and that this mandate would provide a backing. And I loved that there was an individual that spoke from the community that talked about the branding and about how we could brand it as a safe place to be encouraging to people to come here. And I really appreciated that. I thought that was an awesome perspective. I liked that a lot. And I also kind of wanted to bring attention to the board and to be a voice for where we don't have representation right here. And it's in the Latinx population who have the highest percentage of deaths from COVID and the highest percentage of cases of COVID. And we do have a substantial population in Door County, and they're lower income jobs in service and manufacturing. And I think that if you want to define a problem and you ask for a well-defined, narrow objective, I think the problem is to protect employees in lower income jobs or essential jobs. That's what I would define the problem as. And I think that making sure those people are protected, for me, is more of a standpoint than caring about like the economic standpoint, because I think that people, I'm people over profit every single day, over and over and over again. So, and obviously I don't think this is an emergency policing situation. I don't agree with people calling 911. I think it's ridiculous to escalate things. But I do believe that a mandate would protect real people. So I think that if you wait for a legal backing, you're losing out on a whole month And I mean, that's what I support. I support the employees. Thank you.
Okay, thank you. Susan?
There are two things that I think we need to do regardless of whether we do some legal action, like an ordinance or an order or whatever. And when I say these two things, that's not discounting. I'm not saying I wouldn't support us doing something. I think we need more information and we need to target and all of that. But no matter what we do, I think we have to take a more strong stand publicly as to how our businesses and how our people handle it. I mean, I know we did some marketing, I know we did some things, but I think we need to look hard at how well they've worked, and then we have to up our efforts. And by that, I don't just mean the county board or the county staff. I mean Destination Door County, DCEDC, the business organizations, you name it. We need everybody to do this. Someone has written to me and talked about the community of Breckenridge, Colorado, where they have a really strong marketing influence and a lot of signage and a lot of stuff going on in the community on the whole idea of masking to be safe and other appropriate actions. And they are having a different reaction than we are. People are masking. People aren't angry, or at least they have not witnessed it. So I think we need, just plain as part of that task force, whether that's the venue or whatever, I think we got to take a stronger stand. I agree with what a lot of people have said. The other thing, and I'm going to get on my high horse here, and that is that in a lot of states, as you watch the news on this, state governments have taken a stand for their people, and we were kind of left in the lurch. And so it's time for our state government, our administrator, governor and his staff, and our legislators to start talking again. And so what I'm saying to the people who are listening, as well as us, at the very least, the county board of Door County could write a letter and simply say, hey, folks, when the Wisconsin Supreme Court thing came out, we heard legislators talk about how they would maybe not have something immediately, but they would get together so that they could support their local communities. I'm not seeing that happen. And I would ask, for every email that the public sends me, could you please also contact them and say, look, it's time to start talking. It's time to start helping out these communities instead of having 72 communities trying to figure out what the heck to do to make this work in this state. So that neither of those is to discount whether we should do a legal action of some sort. I think we have to keep looking at that. But in the meantime, no matter what we do, I think we need to do those two things.
Thank you. Excuse me. Vinnie?
Thank you for hearing me again. I would like to add in, I really appreciated people who made comment to me through email and conversations that another concern that makes this important for Door County is the lack of health insurance that many of our employers and employees are able to offer and have, which puts a whole other level of financial instability and worry for people if they were to contract COVID and have to deal with that medically in the present moment and beyond if there's lingering effects of that. So I think that that's another reason to consider something unique in Door County for masking and for supporting the employers and the employees that are trying to do the best they can for the visitors coming, for the residents, and for the people coming to their businesses. I understand that they are able to refuse service, but I do think that that's very difficult to do when you're in the business of service. That's a very hard thing to do. And I actually don't know how you would do that without calling someone if someone refuses to leave. It just does make people angry and puts people in a hard situation. So I do agree with Susan that we do need to take some time and really be very specific about what we would decide with an ordinance and make sure that it's supporting in the way we want it to and not putting too much stress on law enforcement. I just think all of these things need a little bit of time. I know we don't have a lot of time, but we need to take enough to make a decision that we feel good about. Thank you.
Thank you, Vinnie. Nissa?
Morning, everybody. I wrote something last night that I debated on sharing because a lot of it is a personal story. So on December 23rd, 2013, my 12-year-old son passed away due to a brain tumor. So while I realize that this has nothing to do with COVID at all, it's formed a close bond between a mom and I, who has contacted me weekly, daily, and sometimes hourly because of her son. He's terminal and immune compromised. She's been told by his doctors that this illness will kill him, if not severely shorten his life, and make his day-to-day existence painful. In fact, we talked yesterday all about this too. When an outbreak happened at her husband's job, she was close to hysterics. He was able to use time off with a medical note. I know the pain she experiences firsthand of watching your child decline and knowing that things aren't going to improve. She and her husband are now both working because they still have to house and feed their kids. About a month ago, my son Soren was diagnosed with a seizure disorder. And right now, it's unknown how this illness would present itself with him because the data just isn't there. It's not available. Every single time that this family or I leave our homes, we are putting our children at risk. Every single time someone doesn't wear a mask, they're potentially murdering our kids. I understand this helplessness that the other mom feels every single day. When people have said, my body, my choice, or I will not comply, they're saying that other people's lives don't matter, even if they're children. I've heard stay home if you don't feel safe. Does that mean you'll volunteer to pay for the people that could die and their caregivers so they can stay home? Wearing a mask isn't about you as an individual. It's about keeping our most vulnerable safe and not making another mom have to bury her child when we can prolong that child's life. As the mom that I mentioned before has said to me and to others, your acceptable loss is my whole world. And, I apologize for getting emotional, but 6 years later, you don't get over things like that. And it's impossible to ever get over things like that. So to the people who think that death isn't that big of a deal, or permanent things that can happen to the people who do get sick and don't fully recover, there are things you need to think about before saying who cares about the rest of the country, who cares about the rest of the people, and it's all about me. Thank you, everyone, and I hope you at least consider what I said.
Thank you, Nissa, I appreciate it. Nancy?
Well, after that, I don't know if I want to say anything at all. But I, as much as I appreciate everyone's comments, I have to admit I am with Aaron. We've heard it: no shoes, no socks, no service, no mask, no service. Where does this end? Are we going to tell people what color they can wear on the next day of their clothes? This is like civil liberties as far as I'm concerned. It's not, granted, I wear a mask when I go in a store, but I don't think I should be told that I have to wear a mask. That's part of my civil liberties. And I'll be honest with you, you know, my doctor told me I can't have ice cream. Guess what? I never used to like ice cream. Now I want it all the time. You know, it's like, I think, you know, we have to think about some of that stuff. And as much as I hate this commercial, you know, that one with the 911 they call because the two people are shaking hands or whatever it is they're doing, are we going to get that bad? You know, our sheriff's department can't handle that. There's no way we have enough people. Thank you.
Megan?
Thanks. One thing that I had not included in my statement earlier that I would like to get on the record is that I would suggest that we consider an off-ramp for any sort of mandate. I would suggest that whatever we would put in place would run through at least October, which is our tourist season. I am most definitely hearing from folks that that is what we need to target, and that there would also be a set threshold of specific numbers set forth by the health professionals of our community. So like what we've had in the past between the hospital and public health. Thanks.
Okay, thanks, Megan. Todd?
No.
No.
Is it on? Little timeout.
Just a few short comments. I certainly appreciate all of the texts and emails like everyone else, and certainly the community's gotten behind certainly voicing an opinion as to how they feel about this, and to all those that have sent to all of us, I certainly appreciate that. A difficult situation at best, I guess, doesn't need to be said, but from my perspective, and probably the perspective of a few people that I've heard about, I think the one thing I from my perspective, feel is that probably not too much unlike the debate we had a couple of weeks ago about towers. Okay, these are different debates, of course, but as a county, I think we took an action a couple of weeks ago as it related to towers in the county, fully understanding that we were taking an action that the public was going to support because there was a strong sentiment to do that, fully knowing that probably isn't going to make everybody at any single moment ready to have internet. I think kind of in some ways this debate is very similar to that. I in no way, shape, or form feel that an action that we take this week, next week, or the week after to make mandatory masks is going to fix Door County, Northeast Wisconsin's COVID issues. That's just not going to happen. It may be a Band-Aid, or it may be something that someone can stand with to maybe help their business run a little bit better, things of that facet. I mean, the harsh reality of it is that we've got a pile of people in the county, which is what we want from an economic perspective, but there are polar opposite results to that. It's like, we want you to come, but we need you to be coming in this facet. And that's a very difficult message to convey, no matter which end of the spectrum you're at. So that's only really narrative and only perspective. Personally, I've not been involved in government all that long, you know that, but I just think it's very bad political business to put an ordinance out or put some sort of a law, whatever you want to call it, out there that you do not intend to enforce. I think it's just bad business. You know, currently we've got an ordinance out there right now that we were the first in the state to enact that talked about 50 people and social distancing, and you could have been fined. I don't know if anyone has been fined or if anyone has had any civil citation that's been issued to date. I strongly believe there's things we can do. There's probably places that we can lay up short. And using maybe a golf term here, that could maybe have some effect on the county in some of the hot spots, try to really go after those hot spots. And talking to some folks in the Visitor Convention Bureau, they're worried about confusing the public that's coming up. You can have it here and you can't have it there.
I think no matter what happens, we're going to have somewhat of a confused public, as I think we have somewhat of a confused state right now as to the direction that we're heading. So anyway, that's just a few comments that are maybe not necessarily tipping a hand on a direction one way or another, but I think it's some things that we should consider when moving forward, if we move forward. I know, no doubt, there's no doubt in my mind, we're going to be 100% wrong 50% of the time on this topic when we walk out of here. There's no doubt in my mind. I'm certain there are people that are listening in, how dare you, county board, not take action today because you will save somebody's life tomorrow. I'm sure of that. We're going to hear that. I guess we're going to bear that for several weeks to come until we come to some setting spot. I think we have to be prepared for that. So thank you.
All right, thank you, Todd. Anybody else want to weigh in? Okay. So I guess at this moment in time, what we're looking for is a consensus one way or another as to whether we should have public health and our corporate counsel look at doing some type of order and or ordinance. If we want them to proceed down that direction to see if they can put something in place on a narrow basis, as Grant had talked about and has been expressed here, if we want them to proceed down that path or not. Certainly it's not going to be imminent. It will take a while to do that if that's what we want. So I guess I will just ask, this is not a vote, okay? I would just ask for a show of hands if you would like corporate counsel and public health to begin to work together and look at enacting some type or putting in place some type of ordinance / order that we give them that indication. So if you want that to happen, please raise your hand. If you don't want that to happen, please raise your hand. Okay.
Yeah, the camera's here.
Oh, cameras are here. Okay.
Yeah.
Sorry. All right, thank you. All right. So based on the majority of the people that raised their hand, we do not want to proceed with having public health and or corporate counsel look at an ordinance or some type of order. So that's what we came to accomplish today. I'm sure that we'll have ongoing conversation as things continue to occur and evolve with COVID. But I thank everybody for their input. I believe it was a good thing to have this meeting, get all the public input, and hopefully we'll continue to move forward. What? Dave?
Yes, I was one that didn't support an ordinance at this time, but I really do think we should work on recommendations, and as Sue and others alluded to, I think we can send a message to the public that we want to try to make it safer for everyone. I think that's something people would support.
Okay, thank you, Dave. Grant?
Irrespective of what the county board does today and the majority wants us to go moving forward, both Sue and I will continue to look at it from my perspective, a legal perspective, from Sue's perspective, from the public health perspective, and we'll come forward with recommendations, which is, I think, what David's saying. We're not going to stop working on it.
Right. Dan?
Well, I think what the county board should do now, though, almost everybody I think agrees that wearing a mask is important. And the question is whether it's civilly right or constitutionally right, and whether we can force it, whether we can mandate it is a question. But it'd be nice, I think everybody, the way I understand, agrees that wearing a mask and social distancing is extremely important. And we should somehow go on record as portraying this to the people of Door County and visitors coming here, that it's important that they wear a mask, social distance, and et cetera. And then follow through after that. But I think everybody's in favor of that.
Well, this one thing, I guess, I don't know if David wants to do a poll, but I guess one thing that obviously we can do is, I think Todd used the layup short, but there are some other tools in the toolbox I think we can do. Obviously, some of that, there's some cost of that. So, for example, we've talked about it. At one time, we had the highway sign that had the city of Sturgeon Bay head down at the county line in terms of the following the Safer at Home order. We could, I don't know if I can guarantee the grant dollars for it of the money, but it's my understanding we could. but we could order, for example, we could order like 2 message signs, or I think they're like $4,500 each. But we could do educational messaging on those signs of saying, please mask for the protection. It's not, and we also could rent, I guess, time on the digital billboards coming up. Those are expenses. We don't have those budgeted, so, I mean, it's something I could work through David under our emergency rules. I've been trying to limit that, going through that process, so, but I think there are those types of tools, educational-wise, that we could try to promote to tourism. I also could reach out to, Destination Door County and stuff like that, to have them maybe help with some of that messaging. They have I know a firm on board that's helping with that, but those are the type of things that I think we could do irregardless of what we decide in terms of getting more active in our messaging. But again, to get more active in our messaging, there is a cost related to that. So I don't know if you want me to, I guess, follow the channels and take that through finance, or, give me some nods and say gear up and let's start getting some of that messaging out now because we're in mid-July. But again, I guess I'm just looking for some guidance or some support of which way you'd like, because I don't want to get, again, I'm not trying to abuse our emergency rule order. I know it's a concern for everyone, but I think there's certain things that we could do that are not truly expensive, but we could invest some money to get some stronger messaging out.
Okay. Megan?
Thank you. Yes, we do definitely need signage as far as marketing and education goes. And I would ask that in that, the plea be very specific to protect Door County locals and as well as service workers. I think that is really key to let people know that they need to be more mindful than what they have shown to be already in the last few weeks.
Thank you, Megan. David? Dave Engelbert?
I didn't realize I had requested to speak.
Oh,
But anyway, since you asked, okay. I think it's important that we protect individuals locally, but it's important to protect our visitors too. It's everyone that needs protection, and if we can do things to enable our employees to work with the visitors here to promote the wearing of the mask, that's good also.
Okay, thank you. Okay, Susan. Susan.
Okay, even though it says I'm number 2 in the queue? Okay. I would challenge that that planning team, if it's still in existence, or at least all the components of it, to gather some data for us. How many businesses are complying? How many businesses are, just a better sense, because I agree with Vinnie that if we do something down the line, we need to have a threshold kind of a thing. What's working, what's not working. I know we got lots of emails, and I don't doubt the sincerity of them or the value of those numbers, but they don't give us a broad look at what's happening in this county. And we've all got our anecdotal information. I went to Walmart's and it was like this or whatever. Somehow we have to get a better handle on what's really happening, so that if we do at some point do an order or an ordinance, it is targeted at something and has some specifics to it.
Okay. Before I go to Bob, I'll just make a comment, because I get asked by a lot of people and get communicated by. What I have been struck with over the last week, when this issue became the hot button issue, was the number of businesses that have contacted me. The business organization, Destination Door County, they're asking, Door County Memorial Hospital is asking that we put something in place. And it is related directly a lot to employees. They want to keep their employees safe. I hear a lot from businesses directly, from DCECD and Destination Door County. What they're saying their problem is that the employees may be wearing masks, and the employer is trying to do what they can. But when people come in and don't wear masks or refuse to wear masks, or don't comply with their signs on the door, ask them to wear masks. It's their employees that are at risk.
Yeah.
And that's what they're mainly concerned with. I mean, that's the underlying theme that I've been getting via the business. And so the bulk of this has come from business. Secondary to that, yes, we have a lot of local residents that feel they cannot go out to a lot of public places that they would like to go because of the number of people, visitors, that do not, and I'm not trying to demonize visitors, heaven forbid, but because they're not wearing masks, they feel compelled to either go in a corner of a store or not show up in the store and leave the store. And they would also like to be able to go out and enjoy Door County in the summer, just like anybody else. So those are the two underlying themes that I've gotten directly from the businesses and the organizations that have contacted us. So, Bob.
Thank you, Mr. Chairman. Excellent lead-in. Because I have a number of the businesses that I heard from prefer to, and it really is about the messaging, right? How are we, what are we conveying? What do we want to encourage? Many of the folks that I heard from don't want the business from the people who are rude or are, just not following or not able to comply. People threaten, oh, we'll take our business to Wisconsin Dells, and I've heard from a number of businesses, great, take your business to Hayward or Wisconsin Dells. We want Door County and Door County's business atmosphere to stay sort of friendly and kind, and that means put a mask on. It's not killing you. Just put a mask on. So I think that's one thing, and I think then just this idea of messaging. I absolutely agree with what Susan said. I agree with what Vinny said. In fact, I find this very interesting today because maybe it's just because the issue is so broad. It's just I've agreed with everything that everybody said today, and I think I hope we can rely more. I know Destination Door County just worked with Peninsula Publishing to do a new little video that promotes this idea of kind, be kind, wear a mask kind of thing, and that's great. I hope the Visitor Bureau, or Destination Door County and EDC maybe can become, again, I think we need, however we can work with them and encourage them, and I would love to see a billboard on the south end at the county line. I love the idea of these electronic message boards, and again, it's really just about messaging. I mean, it's, I don't want to take anyone's rights away or impose anything on them, but I mean, do we need to be self-focused and unable to see the greater good and all Machiavellian, or can we be a little bit more, just think about the precautionary principle, better safe than sorry, think for the larger community. Those sort of, that message that could be a little bit fluid, but I think, again, like how do we what do we want, how do we want to appear? What do we want to attract? Do we want to attract righteous, or do we want to attract kind? And do we want to be righteous, or do we want to be kind? So that messaging is difficult, but I don't think it's, I think that's really the thing, is to work on that messaging. And I think we have a lot of support, across the board on that. Thank you.
Okay, thank you, Bob. Vinny?
Thank you. I just want to reiterate that as well. I think the messaging is the most important part. Whatever we decide in the future about an ordinance or not, people won't even know about it unless there is positive messaging. So I think that that's the most important part, and I would like to see that be enacted under the emergency use of the ability of Ken and David to make some of those decisions outside of the budget. I think it's really important to get that positive message out, and a lot of it is also just confusion and misunderstanding. I have people that are relatives and friends from other parts of the country that will say, should we bring our masks? Are they required? There just is enough confusion around the whole country about it that I think a clear message could go a really long way. So thank you for your effort on that.
Thank you, Vinny. Biz?
Thank you, Mr. Chairman. And I also want to thank you again for notifying the public that sent emails to all of us supervisors. And just because you didn't get an answer from us doesn't mean we're ignoring you. We're not going to agree with you want us to mandate it. We don't want to agree with you if you don't want us to do that. But I listened very carefully to Corporation Counsel about liabilities. And I'm all for businesses asking you to wear a mask. That's fine. But mandating it and saying that you must wear it or you cannot enter, I think you're opening yourselves up to liability, because there's maybe not thousands and thousands, but there are people out there that are diagnosed with asthma and breathing things that are not able to wear a mask. And if you refuse them to come into your business, because you have to wear it, and they can't because of issues that they have with breathing, you're opening yourselves up to lawsuits and liability. And I just want to make that statement because we have to look at it too, and by mandating stuff may really open up a lot of liability. Thank you.
Thanks, Dennis. Megan?
Thanks. I actually just got another message from one of my constituents offering, as a pregnant woman at risk, that saying that we should definitely have a photo campaign of some sort, photos of servers, elders, kids, gals who are pregnant, so on and so forth. And so far, there's a list of about 5 people who have already contacted me prior or have spoken in this meeting who are happy to help in any way that they'd be able to.
Vinnie?
Thank you. I thought the Dane County ordinance had a very powerful line in there that was about if they were exempting people that have medical conditions and reasons they can't wear a mask. And this may sound too simple, but they are simply saying, please respect people in general. If they cannot wear a mask for a medical reason, then be a kind human and respect that as well. And I think that we can rise to that level of kindness and understanding why someone can't wear a mask for a medical reason or for a claustrophobic reason or a mental health reason. I think that that's very reasonable, and that should be on the same end as asking people who can wear them to wear them. So thank you. I think that can be addressed.
All right, thank you, Vinnie. Okay, I think we're about ready to wrap this up.
Could I
please?
Just one last thing. So just so we're all on the same page, just because I think we had one excellent discussion, but I just want to reiterate where you're expecting us to react in terms of your staff. So in my mind, obviously, from the public health standpoint, Sue has her authority to obviously assess the situation day to day, and she ultimately has the right to make a decision on whether or not she wants to pursue any type of order. But I think the discussion helped her at least hear where your minds and support is for her actions. So that's the public health side. On the ordinance side, we will not be drafting an ordinance, but I will be working with Grant, and we'll continue to monitor, I guess, the activities of both WCA and also the courts. So that way it can be a discussion that's either brought up through admin or something like that. But again, in terms, I just want to make sure your expectation is we're not going to have an ordinance on the next county board agenda unless something happens in between there. We'll be monitoring it, but we're not putting anything together. Lastly, I guess just based off what I've heard this and from some of the nods, I will work with trying to improve some of our messaging. I will try to put something together in regards to that. I will run it through David, make sure he concurs, but we'll try to, I guess both leverage more messaging through our destination Door County, but also on some of our own messaging. If there's some things that we could, I guess, reasonably expend some funds on to increase our messaging, that's what we'll do. So those are, I guess, from my 3 takeaways today in terms of what you're expecting us to do as staff.
Susan?
I would ask that in addition to bringing it to admin, the things that you discover and recommendations that you have, that it be on the county board agenda every.
Parks update?
I mean, people need to know how this evolves. I'm hoping we can get more information and have a more informed, way as time goes on, but let's keep it with the 21.
Okay, good. Okay, announcements. Our next regular county board meeting is July 28th at 9 a.m. The meeting per diem code for today is 710. And a motion to adjourn would be in order.
Motion to adjourn District 15.
Seconded by District 16.
We have a motion and a second. All in favor? Aye. Opposed? We're now adjourned. Thank you, everyone.